Hi, my name is Shelby. I'm going to be doing your head to toe assessment today. Can you tell me your name and age?
Karen, age 62.
Thank you. So the patient is well nourished. She appears to have good hygiene. She's answering questions appropriately. Her speech is logical and clear. Appears to be in no apparent distress. She has appropriate mood and affect. Her facial expressions are consistent with her age and cognitive level. She appears to be alert and oriented and in no apparent distress, which I think I said already, but that's okay. So we're going to go ahead and get started with our head to toe assessment. So first of all, just kind of a generalized look over the skin. Skin appears pink, warm, and dry. No obvious deformities noted. No skin injuries, lumps, bumps. Really the only thing that's noted here is just a small abrasion to the left lower arm. We're going to go ahead and start with inspection of the head, the scalp. So just looking, I don't see any lumps or bumps, no swelling, no lacerations or anything like that. Her facial features are symmetrical. Her expressions are appropriate. I'm going to go ahead and palpate your head if that's okay. I'm just going to feel your scalp here. I notice that her hair is evenly distributed, and as I'm palpating, I don't notice any abnormalities like lumps or bumps, no lesions or anything like that. While I'm here, I'm just noticing the external eye features, the eyelashes, eyebrows, and eyelids, which all appear to be normal. Her eyelashes and eyebrows are evenly distributed. I'm going to have you, we're going to check your pupillary response, your EOMs, while we're here. So I'm just going to have you look at my pen light here. Just go ahead and look right at my nose. And I'm going to bring my pen light in from the side and check your left pupil response, which it does react to light. We're going to go ahead again with the left and check the right eye, which has consensual reaction to the light going into the left eye. We're going to check this side here too. We do have pupillary response on the right, and we're going to check again, and pupillary response with consensual on the left. So her EOMs are intact. Again, while we're here inspecting the head, I'm just going to check your frontal and maxillary sinuses. So if I could palpate and you tell me if you have any pain. Here.
No.
Here.
No.
Here.
No.
Here.
No.
Okay. Then we're just going to, I'm going to pull down your lower lids just a little bit, check your conjunctiva. They appear pink and moist, no cobblestoning. We have china white sclera with blue iris. I don't notice any obvious discharge or abnormalities with the eyes. Next, we are going to check the 6 fields of gaze. So if you could just look at my pen right here. Don't move your head, just move your eyes in each direction. Very good. And we will check your nearsighted vision here with this card. If you could hold this about 12 inches from your face and cover your left eye, please, and read the first line.
Little Red Riding Hood.
And then if you could cover your right eye and read the second line.
I saw it on the TV last night.
Okay, thank you. I'll take this. All right. And next we're going to move on to the ears. First I'm just going to inspect the ears. Just going to pull back your hair a little bit here. So I'm just inspecting the outside, the external ear structures. No excessive piercings, no drainage. The auricle are intact, no skin breakdown. Come over here, check the same thing on this side. Just inspecting. Again, no drainage, no excessive piercing. The skin is intact. Next, we're going to palpate for any pain in the auricle and tragus. If you could tell me if this gives you any pain.
No.
Tenderness here.
No.
No. And same thing on the side if you have any pain or tenderness in the auricle.
No.
Or the tragus.
No.
Okay. So next we're going to move on to your nose. So I note that the nose is symmetrical and it's centered in line with her face. I'm going to check for the patency of each nair. So I'm going to hold this nair closed, if you could breathe in and out. And then on this side here. So each nair has equal and bilateral air exchange on each side. Next, we're going to move down to your mouth. On inspection, her lips are pink and moist, no cracks, no cuts, sores, or anything like that are noted. If I could just have you, I'm going to look in with my light, if you could open your mouth and say ah.
Ah.
And stick out your tongue for me and say ah.
Ah.
Looking around. Just noticing that her tongue and palate are pink and moist. No teeth missing, no dentures, no sores or cuts or lesions or anything like that in the mouth. I did notice that the uvula raises and lowers. Tonsils are +2 bilaterally. One more thing here, if I could have you clench your teeth. Okay, and good. Okay, moving on. We're going to move on to the neck here. So just on inspection of the neck, I don't notice any jugular vein distension, no cuts or lesions, anything wrong with the skin around the neck. I am just going to palpate for your carotid pulse one at a time. Here we go. Equal and bilaterally, +2 for the carotid pulses. We're just going to palpate the trachea, which you notice is midline here. We're going to test your range of motion in your neck. If you could turn to the side here and the other side, up and down. Okay, I'm going to put my hand here. If you could push against my hand and push against my hand this way, and then shrug your shoulders. Good, thank you. Okay, so moving on. While we're here, we're just going to palpate your lymph nodes. So we're going to start with the pre-auricle, the post-aurical, occipital, the post-cervical chain, and back up, the pre-cervical chain, anterior cervical chain, and back up, the tonsillar, mandibular, and submantle, and the supraclavicular. All right. So here we are just going to inspect the shoulders, the hands, the arms. No obvious deformity noted here. We're going to go ahead and move on to the posterior chest. I'm going to come over here actually. Normally I would not have my patient move. I would just move around them, but for the sake of the video, I'm going to have you take one scooch this way. There we go. So we're just inspecting the posterior chest. No obvious deformities with the chest are noted. Normal and equal bilateral rise and fall with each breath. I'm just going to place my hands on the posterior chest and ask you to take in a deep breath. And normal rise and fall, equal bilateral, both sides is noted, with the hands on the back of the posterior chest. Next thing we're going to do is the tactile fremitus test. I'm going to place my hands on the posterior chest wall, and each time I place my hand on you, if you could say the words 99. So here we go. Go ahead.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Thank you. Next, we're going to percuss each lung field. So we're just going to tap along each lung field here. Next, we're going to check for CVA tenderness. I'm going to place my hand here and give you kind of a light pat. If you could tell me if you have any pain or tenderness.
No. No.
Okay. Next, we're going to auscultate the lung sounds. Each time I put my stethoscope on your back, if you could please take a deep breath. Go ahead. Okay, thank you. Next, we're going to move back to the anterior chest. I could have you swing your legs around this way. So just inspecting the anterior chest. No obvious deformities are noted. She is breathing with ease, normal rise and fall of the chest. We're just going to palpate the precordium for the PMI. We're going to find the fifth intercostal space, midclavicular line. So we're going to go fifth intercostal space, midclavicular, find the apex, and feel for any heaves or thrills, which none are noted. Okay, next we're just going to listen for heart tones. First using the diaphragm with ape to man technique. Just breathe normally. And then with the bell. Heart sounds are normal, regular rhythm. No abnormal sounds were noted, no murmurs or anything like that. So next, if you could lie down for me, and we'll move on here. And then move, yes, I think you can see me okay this way. So next we're going to assess the abdomen. Oh, sorry.
That's okay.
Next we're going to assess the abdomen. So first we're just going to inspect the abdomen. It appears flat, non-distended, no masses, lesions, or anything like that are noted. Are you having any pain or tenderness in your stomach?
No.
Okay, so next we will auscultate for bowel sounds and for the aorta. So we're going to start with the right lower quadrant, right upper, left upper, left lower, and for the aorta. No abnormal sounds noted. Bowel sounds were normal and active in all 4 quadrants. Next, we are going to percuss the abdomen in the same order. So right lower quadrant, right upper, left upper, and left lower. And then we're going to start with palpation with light pressure. Any pain here?
No.
Pain here?
No.
Pain here?
No.
Or pain here?
No.
Then we'll move on to deep pressure here. Pain?
No.
Pain here?
No.
Pain here?
No.
And any pain here?
No.
No. So the abdomen appears normal, no pain. Again, it's flat, non-distended. We'll move on from here. Next, we will just inspect the legs. Again, no obvious deformities are noted. Her skin is intact. Skin is pink, warm, and dry. We're just going to test her dorsalis pedis pulses, which are equal bilaterally +2, and posterior tibialis equal bilateral +2. Good. All right, if I could have you sit up for me. Okay. While we're here, I'm gonna again inspect the arms, elbows, the hands. No obvious deformity here. We're just gonna check for capillary refill in each fingertip. They're equal, bilateral, and less than 3 seconds in each fingertip. If I could have you flip your hands over side to side a little faster. Good. Cerebellar reflex is intact. Next, we're going to test the superficial touch. And I have this cotton ball here. If you could close your eyes, I'm going to touch you in various parts of your body just softly, and if you could tell me where I'm touching you. Here we go.
Left cheek. Right cheek. Left arm. Right arm. Right hand. Left hand. Left leg. Right leg. Right foot. Left foot.
Next thing we're going to do, if you could take your heel from your left heel and put it on your right shin and move up and down. Good. And then the right heel on the left shin up and down. Very good. Okay. Next, what I'm going to have you do is stand up for me, please. If you could, I'm going to come this way. If you could come just right here and turn around and walk this way for me. And walk back, heel to toe in tandem. That's what they call it. And if you come forward right here, okay? Thank you. And if you could put your your feet together, hands at your side. I'm actually gonna have you back up just a little bit. Okay, right there. If you could keep your arms out to the sides and close your eyes and lift one leg up for the Romberg test. Okay, heels back together and other leg, please. There we go. Thank you very much. Just a couple other things here. We're gonna test, oh, I guess now I'm out of the picture. The range of motion of your spine. So if you could lean forward for me and backwards. Okay, side to side. And then twist. Okay. Okay, a couple other things here. If I could have you sit back down for just a second.
Sure.
Just gonna test your reflexes. So we're going to start here with the deep tendon reflexes. So we have the biceps, and we're just going to hold here and reflex there. Around. Again, hold. And we have a reflex there. Next is the patellar. Let's see, ready? Try one more time. There we go. Sorry.
Yeah.
And one over here. Oh, yep, and we have a reflex. Okay, next is the Achilles, which I'm gonna adjust this a little bit, maybe. Turn to the side. So you can see better. That's not gonna work. That'll work. Okay, next we're gonna test the Achilles. You're gonna hold your foot flexed here, and we're gonna feel a tap. Oh, sorry, I missed. I'll try it one more time. Oh, sorry. And we're gonna go down. There we go. Okay, again over here. 1, 2, 3. Try one more time. Good. Here we are. Last thing we're going to do is the backwards J. It might tickle a little bit on the bottom of your foot. And she's a negative Babinski, which is only positive in babies. So, I do believe that concludes the head to toe. So thank you very much for your participation.